wife is saying, ask somebody for directions. You don't know where you're going. And of course the male says, I know exactly where I'm going, and then they land up in the small intestine, and he says, see, I told you I knew where I was going. All right, in the low burden version, generally asymptomatic. Now you can see eosinophilia, although it's transient. You'll only see eosinophilia during that phase soon after exposure to the eggs, when the larvae are migrating for a few weeks through the tissues. At that stage you'll see eosinophilia. The eosinophilia then will disappear as the adult worms establish themselves in the gut lumen. The other symptom that's important is you see passage of worms. So you sometimes see this spontaneous passage of mascara, and that's populates the attention. It's really not that exciting from a pathologic point of view, but it is exciting for the patient. I suppose the other symptomatology is they pass a worm and then they faint in the bathroom and they hit their head on the sink and then they need sutures. That's probably the most common and most serious pathology associated in the non-tropical world. But in the high burden in areas where this endemic high burden of worms, now you get more abdominal symptoms. You get this, again, malabsorption, malnutrition, cognition problem, and occasionally you can get small intestinal destruction. So in terms of pearls related to Ascaris, although it's not common, it's a small fraction of the infections, it does happen that the adult worm migrates to aberrant places. So occasionally it migrates and can block bile ducts, pancreatic ducts, and that'll be cause things like ascending cholangitis or liver abscesses, obstructive jaundice, pancreatitis, that kind of thing. In high burden infections, it is a somewhat, say, not infrequent cause. By causing a partial small bowel obstruction, you get intestinal surgery and anastomotic leaks and ruptures. We do see Ascaris occasionally vomited instead of passed in the stool, and that's especially during pregnancy. Presumably that's an effect of, it's getting kind of crowded down in the abdomen, and this worm that's been happy in the small intestine is now finding things, the neighborhood just isn't quite as comfortable as it used to be, and it wants to leave, and it can't go down because it's just too difficult that way, and so it goes up. So vomiting Ascaris worms is typically associated with pregnancy, which I'm sure obviously pregnancy is all that much more fun. Loeffler syndrome is one of the classic causes of a Loeffler syndrome, especially seasonal Loefflers in places like desert. Loeffler syndrome associated with Ascaris was actually first described in Saudi Arabia, but it has to do with that stage when you're migrating through the lung and you get that transient eosinophilia and migratory pattern of chest X-rays. As I mentioned, it's a contributor to that geohormone malnutrition and childhood development triad. So the main, as I mentioned, Ascaris, Trichuris, hookworm are the main triad that we refer to. And like I mentioned, Ascaris, according to human Ascaris and the pig Ascaris, are very similar. They look similar. They can probably hybridize because there have been worms that have been identified that are clearly hybrids of the two. And if you have a pig reservoir, then it's going to be difficult to solve the problem just by providing sanitary facilities for people. Okay, hookworms. So the two main hookworms, they're not the only two, but the most common ones, Ancylostoma duodenale and Necator americanus. They cause, each one is predominant in different parts of the world, but they are scattered over large parts of the world. The cartoon says that's a polar bear, and it says endangered species. Polar bears are obviously endangered species behind it, but the cartoon is meant to remind you that this is a little bit different. That it's contact with the feces here, skin contact with the contaminated soil, fecally contaminated soil. That's the cause, that's how the infection happens. The presentation, again, low burden disease, generally actually asymptomatic, sometimes eosinophilia, because the life cycle is actually the same as Ascaris. It doesn't hatch in the intestine and do that migration. It invades the skin, typically